Welcome to the December 2016 issue of our monthly Mayo Clinic Proceedings multimedia summary. I'm Dr. Thomas Gerber, Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. So what are the Editor's Choice and Highlights articles in this month's issue of Mayo Clinic Proceedings? Our Editor's Choice in this month's issue is a review article on the state of the art in the epidemiology, prevention and treatment of atrial fibrillation. This truly epic review was written by Dr. Danielle Morin from the Oxnard Medical Center in New Orleans, Louisiana, and colleagues from several national healthcare institutions. Based on a comprehensive review of relevant articles published between 2000 and 2016, the authors provide you with a comprehensive update on the current understanding of atrial fibrillation, contemporary therapeutic options, and current and future directions of research. Remember that atrial fibrillation is the most common sustained arrhythmia in adults, and that atrial fibrillation tends to be associated with comorbid conditions that are the result of the poor lifestyle choices that we so commonly see. You will gain fascinating insights from this review article that are very pertinent to your practice, even if you're not into the details of antiarrhythmic therapy or radiofrequency ablation. Our first highlight in the December 2016 issue of Mayo Clinic Proceedings is an original article about the effect of a history of cancer on mortality after coronary angioplasty for acute myocardial infarction. This article was written by Dr. Fei-Long Wang and colleagues from Mayo Clinic in Rochester. In a retrospective cohort study of over 2,300 patients with ST segment elevation myocardial infarction, 1 in 10 patients undergoing angioplasty had a history of cancer. In these patients with a cancer history, acute in-hospital and long-term non-cardiac mortality risk was 3 times higher than in patients who had no cancer history, but the acute or long-term mortality risk related to cardiac issues was not increased. And this discrepancy is addressed in an editorial entitled "The Yin and Yang of Cancer and Heart Disease" that was written by Dr. Sadir Al-Kindi and Dr. Guilherme Oliveira from the University Hospitals Cleveland Medical Center and Case Western Reserve University in Cleveland, Ohio. This editorial also addresses 2 other articles on the relationship between cancer and cardiovascular disease in the current December 2016 issue of Mayo Clinic Proceedings. And one of these articles is the second highlight in this month's issue. This highlight is an original article about the relationship between physical activity and the risk of colon cancer in diabetic and non-diabetic adults. The article was written by Dr. Daniela Schmidt and colleagues from the University of Regensburg in Germany. During 13 years of follow-up in a retrospective cohort study that included approximately 300,000 patients, there was no statistically significant relationship between physical activity and colon cancer in diabetic patients, but in non-diabetic individuals, physical activity was significantly and inversely related to the risk of colon cancer. Some of the possible underlying mechanisms for these relationships are discussed in the editorial from the Cardiology Oncology Center at Case Western University in Cleveland, Ohio, that I mentioned earlier. And just like always, you can access these highlights and Editor's Choice articles free of charge during the entire month of December. Head on over to our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org to check out some of the other free content there. Use the social media buttons near the top of our homepage to stay in touch with us on Facebook, on Twitter, and on YouTube. On Facebook and Twitter, we will keep you up to date on online first publications that come out on our website between the monthly issue updates and on news stories that are based on articles published in Mayo Clinic Proceedings. On YouTube, you can find a lot of interesting video content such as the full author interviews and also our 60-second video article summaries. Exciting changes are afoot at Mayo Clinic Proceedings, and this may be one of the last monthly issue summaries in this particular format. But with just a little luck, I get to see you again in January of 2017 with great news. Until then, thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.